Sherbon is the Chief Executive Officer of the Health Department. I caught up with him earlier and started by asking when he first learnt of the problem.
I was made aware on the 16th of July 2008 this year.
You satisfied with that?
No, I think it would have been prudent for the General Manager of the hospital to let their superiors know. It would have been wise to let the department know. But in retrospect, they made a judgment at that time that now needs to be reviewed by experts. And I've commissioned that expert advice. I'm looking forward to receiving it.
By doing that, you're saying you're not happy with what they've done, aren't you?
I think it would have been prudent to let the department know. I certainly want to check out whether their judgment at the time was correct, and that's why I've got the independent expert advice coming.
Even if that panel comes back with a finding that says it may not have been significant in the final outcome of the patients, you've just heard from someone who represents cancer patients saying it leaves them with a cloud and a doubt over their treatment.
Information is very important for everyone. We do understand people want as much information as we have available. Since I found out about this, we've provided as much information to the people affected and the public as we possibly can. And as pieces of information become available, we'll continue to make them public.
Well, did it compromise the patient's treatment?
We don't know yet. We're waiting on the independent expert panel to tell us. At this stage, I've got nothing before me that tells me that any patient was adversely affected. I met with the independent panel after they finished their field work. They want to go away and do some more international research to review the international research literature, and they'll come back to me after having done that. But at this stage, they're not saying to me there's any patient danger at this stage.
Can you guarantee that everyone who was underdosed has now been identified and contacted?
We've identified everyone on 3 checks of our database now. We continue to make sure that they've received the communication. That's been difficult in a very small number of interstate cases, but we now have identified all the patients.
And in total, it's what?
837.
837 patients.
Mm-hmm.
Now, you found 114 extra patients when you were doing the review. Doesn't that make you worry also about the record keeping in this section, that you could find 114 extra?
It was certainly unacceptable that it wasn't apparent on the first review of the patient list that was generated by the computer database that we found additional patients. It was unacceptable, and I agree that we'll need to look at that information system and ensure that it's up to the necessary requirements in future.
But have we got a situation here where you've got a group of people running equipment and running records where there seems to be a problem? Is there an endemic problem?
This is one of the best cancer units in the world. It continues to produce great results. People are living with cancer or have been cured of cancer by this unit, and it continues to produce the world's best results. I don't think there's an endemic problem. I think people should have confidence in the Royal Adelaide Hospital Cancer Services, and for that matter, all other cancer services in South Australia. But on this occasion, I do want to check out whether this underdosing was significant. It's a real issue that the public should know about. That's why we announced it. And we need to sort through whether it was significant. We need expert advice. That's why I've commissioned that expert advice.
Well, aren't you a little bit lucky? Because what if it had been an overdose?
Well, I don't want to get into hypotheticals. We would also need an expert piece of advice to tell us whether an overdose was significant. But we know that there are minor variations in highly technical pieces of equipment. What we need to know on this occasion was that significant? That's why we need the independent expert panel's advice.
Well, you heard in that story a moment ago someone saying there's a cloud and a doubt in their mind. When will you be able to provide definitive answers for people like Ashley?
We should receive the independent expert panel's advice in the coming weeks. It depends how long it takes them to finish their research. We will then release that advice, and we will sit down with patients and their specialist and talk through any follow-up that might be required. At this stage, we don't have anything to indicate that anything exceptional needs to be done. And we'll discuss any relevance to the patients. We'll be able to sit down with people and talk them through it.
What if there's a patient out there watching this who is worried? What should they do now?
Contact us. The hotline 8222-0740 is still available, or make an appointment to come in and see your specialist. We can talk you through the issues. If you didn't have radiotherapy, you don't need to worry. And if you haven't received a letter from us, there is no cause to worry. It's only patients who've received a letter who had treatment on 1 out of the 4 machines. But having said that, if anyone's worried, they're welcome to contact us.
Thank you very much for your time.
Thank you, Ian.